Hi everybody, I'm going to talk about a couple of vaccines that are what we call non-core vaccines. Non-core vaccines that I only give if that pet's lifestyle puts them at risk. That's not everybody, so that's how come I ask everybody, let me know, I tell you what the risk factors are, and then you let me know if their lifestyle is setting them up to be exposed to that, and then we'll talk about it. The first one that we give, and actually the most common one that we give, is the rattlesnake vaccine. I know that sounds awful, but other than not getting bit, this is our best insurance. It's still not an absolute guarantee that we won't have a problem, but it's the best thing we can do. I can personally tell you, I've had at least 2 patients that were appropriately vaccinated with the rattlesnake vaccine, and they came in and all I had to do was give them pain medication and antibiotics. I didn't have to give them the antivenin. The antivenin is really expensive. They have to be hospitalized, and it may take more than 1 vial. The vials can be $500–600 a vial. So once again, this is the next best thing to not getting bitten. So if you or your neighbors see rattlesnakes in your neighborhood, or if you're going to go on hikes or walking trails or anything that you're not familiar with the terrain, talk to us about the rattlesnake vaccine. This is wintertime, but several years ago, my neighbor across the street came knocking on my door on a Friday night. I went over and looked at her dog. He got bit right on the snout in January. Her husband was out of town. I told her to get the dog to emergency, got treated, everything went fine. Husband came back the next day, went in the backyard, rattlesnake was still coiled up next to the air conditioner. So you don't know what time of the year. We know what time of the year is worse, but there's no guarantee. So if you see rattlesnakes or your neighbors talk about it, let me know. It's a series of 2, 4 weeks apart, and then once a year after that. Alongside of that is, as far as the lifestyle goes, is the influenza vaccine. This is the one that I talk to everybody about. Is your pet going to go to doggy daycare? Is it going to go to training? Is it going to go to a groomer? Is it going to go to a boarding facility? Any enclosed area or an area where there's a congregation of a lot of dogs, like some of the parks that there's a lot of dogs there, give this some consideration. It's what we call a bivalent vaccine. The influenza came on the surface about 6 or 7 years ago, and it was a hassle. But then about 4 years ago, it morphed into a very aggressive virus. And so now there's 2 different strains. This vaccine has both strains in it. It's devastating. There's sad, sad stories of people that were bringing dogs over from South Korea last year. People were fostering them. They were infested with the more aggressive influenza virus, and unfortunately a lot of them lost some of their own pets in the house that they were fostering these dogs in. So don't take any chances. If you're not sure, ask me or ask your veterinarian, and we'll counsel you on what the potential risks might be with that. And this is like the rattlesnake as far as frequency. 2 vaccines, 4 weeks apart, then once a year thereafter. Thank you.